Hi guys, welcome back to my channel. Today we are going to be doing a part 2 of the previous video for the NHA CCMA Certified Clinical Medical Assistant exam. So if that's you who's about to take that exam, studying for that exam, keep watching. Let's get started. Okay, so if you see me look down, I'm looking at my iPad. I have all my notes right here. And yeah, that's the reason you'll see me keep looking down, just to make sure that I'm saying the correct things, okay? All right, let's get started. First, we're going to start with the dietary guide. This was on the test, the dietary guide. So they're going to have a few questions on a multiple choice, and they want to know how you would give dietary guide, like a dietary guide to a patient. And the answer would be follow the USDA MyPlate model. Okay, that's the answer. So if you see that, the MyPlate model, that'll be the answer. Now we talked about CLIA waived tests. We didn't get too much into it, so we're going to get into it right now. CLIA waived tests are simple laboratory tests approved by the government to be performed in a non-lab setting. So, for instance, a doctor's office, an urgent care. So, what are those CLIA waived tests? A urinalysis with a dipstick. So, you would know right away, if you have an infection in your urine. It doesn't have to go to a lab. Okay, a pregnancy test, blood glucose. These are just examples. Rapid strep test. So I'm gonna keep going. Fecal occult blood test, hemoglobin test, a COVID-19 test. So you have a question like, what are CLIA waive tests that can be done in a doctor's office? They'll give you 3 multiple choice answers. So let's say they say a CAT scan, an MRI, or a pregnancy test. You're going to know that it's a pregnancy test, okay? So know your CLIA waive tests. Fire safety. Know the RACE protocol and the PASS technique, okay? So the RACE protocol is a standard response if a fire breaks out. So the R is for rescue, the A is for alarm, the C is for contain, and the E is for extinguish/evacuate. Okay, so rescue, you're going to remove anyone in immediate danger. Alarm, you're going to pull the fire alarm and call 911 of facility code. C, you're going to close the doors to contain the fire, and E, use an extinguisher if safe or evacuate. Okay, and the PASS technique to operate a fire extinguisher is PASS. P, pull, A, aim, S, squeeze, S, sweep. Okay, so you're going to pull the pin, aim at the base of the fire that was on the test, S, squeeze the handle, and S, sweep side to side. So they'll have like different answers. I know it was like aim at the top of the fire, aim at the base of the fire, or they had a completely different answer, but you would know that it's aim at the base of the fire and always sweep side to side. I believe those two were on there, the sweep side to side and aim at the base of the fire, but in 2 separate questions. More terms to know. Know these 3 terms, okay? Epidemics, we're going to get into them, okay? Epidemics, endemics, and pandemics. I saw this question as well. All right, so what is an epidemic? An epidemic is a rapid spread of an infectious disease to a large number of people in a given population within a short period of time. Endemics, a disease or condition that is regularly found among particular people or in a certain area. And we all know what a pandemic is because it already happened. A global outbreak of a disease that affects many people across a wide geographic area. Know those three terms. Okay. So here is a similar question on the test. What to do if a person is in shock? Does anybody know? You're not going to keep them cold, okay? We want to keep them warm to prevent hypothermia, okay? So there'll be like a question that says, what do you do if a person is in shock? So the answer is keep them cold, keep them warm, or they'll have a different answer. We know to keep them warm. You also want to call for help immediately. Lay the patient flat. If there's no head or spine injury, lay them on their back and elevate their legs. Again, there might be a question that says lay them on their stomach, lay them on their side. We want to lay them on their back, okay? And elevate their legs. Know that. Know your nail length, okay? Nails generally no longer than a 1/4 inch past fingertips. That was on a test. Supply inventory process. Just know, use an inventory checklist or a log sheet. That's all you need to know. All right, we're moving through this pretty quick just because I have to edit it and put this video on the same day. So if you guys need to slow down, just pause and play. Positions. Know your positions. The main ones that I saw was prone, supine, Fowlers, and semi-Fowlers. But know all of the positions. So we're gonna go through just the prone, the supine, the Fowlers, and the semi-Fowlers, but no lithotomy, no dorsal recumbent, no Sims, lateral, no knee chest, Trendelenburg, and jackknife. Know those as well, but we're just gonna go over these 4. So prone is face down, okay? That's laying on your stomach, and that's for spine exams. Supine is face up, laying on your back. That's more for EKGs and abdominal exams. Fowlers, sitting up 45 to 90 degree angle. That's exams mainly of the head and the neck. And semi-Fowlers, reclined at 30 to 45 degree angle, and that's shortness of breath. So you want to know, if they ask a question like, what position would you put somebody who has shortness of breath? I saw that on the test as well. So you would know that that is semi-Fowlers, okay? Okay, drug urinalysis. Drug urinalysis is screens for the presence of drugs or their metabolites in a patient's urine. All right, so know the responsibilities of an MA for taking a drug urinalysis, okay? Always use PPE. We don't want no urine getting on us, okay? So that's gloves. Yes, wear gloves, okay? You want to make sure that there's usually 30 to 45 ml of pee and the proper temperature, 90 degrees Fahrenheit to 100 degrees Fahrenheit, within 4 minutes of collection. And this is so true because during my program, my school program, I had to take a drug test. And the first time I took the drug test, it just went left. I had, what do they call it? Shy bladder. So I didn't go to the bathroom that whole morning. And then when I got there, it just, TMI, it just would not come out. And it was, when I did it, I didn't know you could only take 4 minutes They stand by the door, they wait for you. So that alone is nerve-wracking, so I couldn't go. But it has to be, like, if you read the paper that they give you at the end, I had to come the second time they gave me the paper. It said 90 degrees Fahrenheit to 100 degrees Fahrenheit, and it was done in 4 minutes. Yeah. So drug urinalysis, they don't play at all, and I did not know that. So if you guys have to take a drug test, like doing urine, just know that that's how it goes. You also want to label in front of the patient and document the collection, the time, the date, and the initials. Okay. Advance directives. What is advance directives? They are legal documents that allow a person to state their wishes for medical care if they become unable to speak or make decisions for themselves. Know these advance directives. I believe all three of these were on there, but if they ask for one, like, I'll get into it. So the common types: a living will, a durable power of attorney, and do not resuscitate, a DNR order. Okay, so a living will states what kind of medical treatment a person wants or does not want, such as CPR, ventilators, or feeding tubes. Okay, know that. Durable power of attorney for healthcare proxy, appoints someone, a trusted person, to make healthcare decisions on the patient's behalf if they're unable to do so. Know that as well. Do not resuscitate, a DNR order, indicates that the patient does not want CPR if their heart stops or they stop breathing. So they have a question, okay? Here is an example of the question. What advance directive states what kind of medical treatment a person wants or does not want, such as CPR? They'll put living will, they'll put durable power of attorney, and they'll put do not resuscitate. But you would know that that's a living will, okay? So know those three advanced directives. Normal hemoglobin ranges. I saw this as well on the test. No female, male, normal hemoglobin ranges. So for female, 12 to 16 G/DL. I forgot what the G/DL means, but yeah. Male, 14 to 18 G/DL. I'm pretty sure, if I'm not mistaken, they asked me about the male. Yes. But it didn't say like 14 to 18. It kind of went down and it was like 13 to 18. But 14 to 18 is in that range. Okay? So know that. Signs versus symptoms versus sequela. Know this. Signs, objective findings you could see, measure, or detect. Observe. These are observed by a healthcare provider. Example, a fever is measured with a thermometer. Symptoms, subjective experiences reported by the patient. These cannot be directly measured by the MA or the provider. And this is, example would be a headache, okay? And sequela, a long-term or permanent complication that results from a previous illness or injury. And this happens after the original condition. And an example of that would be paralysis after a stroke. So know the signs, the symptoms, sequela. Know those three definitions, okay? Flow sheets, okay? Just know you're going to track trends in the patient data. So whether that's the vital signs, the blood pressure, the pulse, the temp, and you would think of a flow sheet like a medical calendar, okay? So flow sheet, medical calendar, I believe that was on the test. Informed versus implied consent. Know this, you guys. This was on the test, okay? Implied consent is non-verbal permission for routine or low-risk procedures assumed based on the situation. Example, A person rolling up their sleeve for blood draw, okay? That's implied consent. A non-verbal permission. Informed consent means the patient understands what will be done and gives permission, usually in writing, for it to happen. As a medical assistant, you don't obtain informed consent. That's the provider's job. Your role may include, but not limited to, witnessing the patient signing mainly the informed consent, because again, that's in writing form. Implied consent is just rolling up your sleeve. Example for a blood draw. Okay. Eye drops. This was on the test. Okay. Main things to know. I wrote a whole bunch of stuff, but I'm just going to go over the highlighted stuff. Sit or lie down. Okay. You're going to tilt their head back, look up, focus on a fixed point, gently pull down the lower eyelid like this to create a pocket. So that pocket is called the conjunctival sac. Okay. 1 inch above the eye into the sac, and then you're going to close their eyes gently, not squeeze. Okay. I'm going to go over that one more time. Just know, sit or lie down. So if they say, how will you give somebody eye drops? It's not going to have sit or lie down. Just know that it's either sit or lie down, okay? Because those will be 2 right answers. Tilt their head back, look up, focus, make sure they're looking at a fixed eye point, okay, a fixed point. Gently pull down the lower eyelid to create a pocket. That pocket right there is called a conjunctival sac. 1 inch above the eye. You're going to hold the dropper 1 inch above the eye and drop the prescribed number of drops into the sac, not directly on the eyeball. And after the drops, you're going to ask the patient to close their eyes gently, not squeeze. Okay. EKG. I haven't done an EKG yet, but I know how to do EKG just from visually doing it on a shirt, to be honest. Okay, let's get into EKG. Like I said, my school was online. A lot of what we did was like on a teddy bear, on a t-shirt and stuff like that. So we did EKG if you had a teddy bear, if you was working with patients, or I did mine on a shirt. If I have the video, I'll post it, but I'm not sure if I have it still. Okay, so EKG, this test records your heart's electrical activity, okay? So know your 4 limb electrodes, your right arm, your left arm, your right leg, and your left leg, okay? So your right arm will be RA, left arm LA, right leg RL, and your right leg is the grounding lead, okay? Remember that. They will ask you what is the grounding, which limb electrode is the grounding lead. Know that it is your right leg, okay? And the left leg LL, okay? So there's 4 limb electrodes, and then there's 6 chest precordial electrodes, okay? Those are V1 through V6. Know the placements of those 6 chest electrodes. So V1 is in the 4th intercostal space, right of the sternum. V2, 4th intercostal space, left of the sternum. V3, midway between V2 and V4. V4, 5th intercostal space, this word always gets me. Mid-clavicular line. V5, level with V4, anterior axillary line. And V6, level with V4, mid-axillary line. Okay, so remember those 6 chest electrodes, and the 4 limb electrodes. Okay? Skin prep. Gotta know you're gonna clean the skin with alcohol wipes. They'll give you so many different options. Just know that it's alcohol wipes, okay? You should shave the chest hair if needed, okay? So a similar question, back to the alcohol wipes. If an electrode is loose, what should you do? Let's say A is use chlorhexidine, B, use soap and water, or C, use alcohol wipes. You'll know it's C, use alcohol wipes. Okay, drug schedules. Hold on, I'm gonna pause this real quick. It's harder when my camera, I just did a whole 26-minute video, so it takes so long to upload to my my iPad, but okay, where were we? Drug schedules. Know your drug schedules. I believe they only asked about schedule 1 and 2, but no 1 through 5. Okay, we're just gonna go over 1 through 2. Schedule 1, no accepted medical use. High abuse potential. An example for Schedule 1 is heroin, okay? And Schedule 2 is also a high abuse potential. Example, fentanyl. Just know the beginning, like in the beginning it's the highest, and then going down, going higher is the lowest, okay? So they're written like Schedule I. It looks like an I, but Schedule like 1, Schedule 2, Schedule 3, and then the IV, and then the V. So here go a memory tip. The 1, so if it says Schedule 1, know that is illegal, okay? And if it has a V, no, that is very mild, okay? So Schedule V or 5 is a very mild potential, okay? And that would be like cough syrups, okay? Just know your schedules, 1 through 5. So what I was trying to say in the beginning, the higher number, the lower the abuse risk, okay? Pharmacokinetics. Absorption, distribution, metabolism, and excretion. Okay, know that. Absorption is how the drug enters into the bloodstream, the small intestine. Distribution, how the drug moves through the body. You could think of distribute, okay? And that's through the bloodstream. Metabolism, how the drug, Giant, he's over there. You don't do that. This is my dog, Giant. We're doing a little dog break. This is Giant. He's 4 pounds, my little baby. He just turned 6 years old. Say hi. Hi. Okay. You messed up my whole thing. Here go a little memory tip, okay? ADME. Add me. How about we say add me without the extra D? A drug moves everywhere. Okay? Add me. A drug moves everywhere. That's how you would know your pharmacokinetics in order. Okay? Wound protocol. While MAs do not diagnose or independently treat wounds, you assist with wound care and ensure the wound is properly managed according to provider order. Report immediately if fever or signs of systemic infection, patient complaints of worsening symptoms. Okay, always follow standard precautions, infection control protocols, and scope of practice for MAs in your state. Abbreviations. Know these 2 abbreviations. LMP. You'll see that a lot in the OBGYN office. Last menstrual period. It refers to the first day of a patient's last menstrual cycle, okay? NP, new patient, okay? I saw this on the test and they try to confuse you because they'll put what does the abbreviation NP stand for? They had new patient on there and they had new provider and they had something else. So I automatically thought maybe it's new provider, but then when I did study this, it's new patient. So they'll give you like a little scenario, and that's how I knew it was new patient. Okay, so NP, new patient. It's used in scheduling and medical billing. Okay, and I think that's how I knew because they did the scenario with scheduling. So you would schedule an NP, which is a new patient. Okay. Autoclave temp, know that the standard or autoclave temperature to sterilize instruments is 250 degrees Fahrenheit. Okay. They asked that on the test, and just know it's 250 degrees Fahrenheit or 121 degrees Celsius. Here I have at 15 psi pressure for 15 to 20 minutes, but just know the temperature, okay? Body fat measurement. For men, it's chest, abdomen, thigh. For women, it's triceps, supraliac, and their thigh. I don't know if I'm saying that word right. Know those body fat measurements. Okay, EKG electrode directions. Know that the arm electrodes are always going to be facing down and the leg electrodes are going to be facing up, okay? Rule for limb lead substitution. If somebody has amputation, what do? If one or both legs are amputated below or above the knee, you're going to place LL, which would be the left leg, and RL, which would be the right leg, electrodes on the lower abdomen. Okay? So the left leg will be on the lower left abdomen, the right leg will be on the lower right abdomen, still on the ground lead, okay? That will be still on ground lead. If one or both arms are amputated, place left arm and right arm, LA and RA, electrodes on the shoulders or upper chest, depending on anatomy, okay? Know that, okay? That was on the test as well. Axillary temp range, underarm, is the least accurate. Know that the axillary temp range is the least accurate, and the normal axillary temp range is 97.8 degrees Fahrenheit to 99.1 degrees Fahrenheit. In Celsius, that would be 36.5 degrees Celsius to 37.3 degrees Celsius. Know that, okay? Business letter greetings. When writing a business letter or email as an MA, whether to a patient, a provider, a vendor, or another office, your greeting salutation should be polite, professional, and appropriate to the recipient. So, if you're writing a greeting, dear, title, last name. Most professional, idle for providers or patients. Venipuncture on infants and children. Infants less than 12 months, Hale stick is usually preferred for routine blood draws, especially newborns, okay? Toddlers and older children, antecubital fossa, most common median cubital vein, okay? Use the smallest needle possible, often a butterfly needle with a pediatric tube. Always explain the procedure in simple, age-appropriate language, okay? I saw that as well. Ask parent or guardian to assist with gentle restraint if needed. Just know that, okay? Wellness exam. Review the schedule and chart. confirm it is a wellness / annual exam. Prep the room, okay? Common supplies for a wellness exam, but not limited to, would be a blood pressure cuff for vitals, thermometer for a temp check, stethoscope, heart, lungs, gloves, standard precautions. During the exam, take and chart vitals, and after exam, provide patient education handouts, okay? Sterile field, always hand hygiene. You're going to open the sterile packages away from your body. This is on the exam. Away from your body, touching only the outside of the wrapper. Again, another question that you'll see. Here go another one. Know this, okay? 1 inch border rule. The outer 1 inch is not considered sterile. You will see that as well. All right, water versus soluble vitamins. This one you will also see. Water soluble vitamins. B complex, B1 through 12. Vitamin C, okay? Fat soluble vitamins. Vitamin A, D, E, and K. So a similar question would be, which vitamin is water soluble? So you get A, vitamin K, B, vitamin E, or C, vitamin B12. You would know that vitamin B12 is a water soluble vitamin, okay? Know that. Normal BPM, beats per minute, ranges newborn to athlete. Know that an adult is 60 to 100 beats per minute, okay? A well-trained athlete, 40 to 60 beats per minute, okay? A newborn, 0 to 1 month, they're usually always higher. As they get older, it'll go down. Newborn, 0 to 1 month, 100 to 180 beats per minute. These are resting beats per minute. Athletes may have low resting HR due to strong cardiac efficiency, and infants naturally have higher HR that drops as they age, okay? But no adult 60 to 100, okay? And then I just had anything else I remember. What is a copay? It's a fixed amount of money at the time of the visit. Know what a deductible is. What comes after the SA, the sinoatrial node, the AV node, which is the atrioventricular node. How to remove sutures. You're going to cut close to the skin. The same number that was put in should be the same number that was taken out, and you're going to place them on a paper towel, okay? And that's it, you guys. I hope that this helps you. You're going to do fine on your tests. Don't overthink it. So with me, when I study, I only study for about 30 minutes to an hour, and I study what I can. If I overstudy, my brain shuts down, literally. It'll shut down and I can't study anymore. So I only do what my brain allows me to do, and that has worked for me when I took phlebotomy and I passed on the first try, and now taking medical assistant and passed on the first try. So don't overstudy, don't overthink it. You'll be fine, trust me. I would say go with your first answer. If you're second guessing it, flag it. You could flag I didn't flag any of my questions on the test, but you can flag the questions. Just know you have 3 hours, and that 3 hours goes by quick. Just take your time. If you believe in God, say a prayer, and you'll get through it. And if you don't, because some things do happen, take it again. Don't give up. I think you have like 3 tries, but I've heard people take it more than 3 times, but you will get it on your first try. Thank you guys so much for watching. We'll see you in the next video. Bye, guys.